Wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Rosell, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Rosell and the Rosell Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Rosell's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomrosell.com/education. That's drtomrosell.com/education.
The information provided on Dr. Tom Rosell Live by Dr. Tom Rosell, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, Dr. Tom Rosell here. Welcome to the program. It's Sunday, and as you know, we do this live, and you'll also be able to find it on drtomrosell.com any old time for replaying. So make sure you have that opportunity to, if you would, keep yourself up to date with the most important healthcare information that you can utilize and make a difference on your own. So we're going to get into your feet again a little bit, but in a very different platform. Made a couple comments on WMAL 105.9 a few minutes ago about the craziness that we have with everybody, kind of going off the Richter scale with the weather changing, if you will, on the eastern seaboard, and we're supposed to get all the snow and like that. So what's that got to do with your feet? It has to do a lot with your feet, and keep them warm. And what does that mean? Keep them warm and dry. Don't go out in your athletic shoes. Don't go out in things that can suck water into them. Keep your feet dry. Make sure you're wearing good warm socks. Wool socks are better. And if you do that, you're going to keep your health generally much more stable. So I grew up in Western New York State, And what we did is we didn't worry about the heavy coats and so forth, but we had a stocking hat on and we had gloves on and our feet were warm. And, we usually had a scarf or something like that when we went outside with, with a heavy sweater or something like that. And it was probably 25 degrees. And you're saying 25 degrees. Oh my God, that's, we're going to freeze. Well, yeah, no, not really. And if you do keep yourself in a good place with your feet, your hands, your head, and your neck, you're not going to get cold. And more importantly, you drop the incidence of getting sick. Now, that's all I'm going to say about that. And we want to move forward a little bit. We talked a little bit about a kind of a new segment I'm adding into the WMAL program. And it's basically your health in the news. And we're talking a little bit about the pneumococcal viral pattern and some of the other stuff, the vaccines that they're pushing out. I said earlier that I am so happy that a guy by the name of Robert Kennedy is going to be heading things up. See, he's not an anti-vaxxer, but he's going to tell you the truth about what's there. And he wants to get all this showmanship advertising off the radio, off the television, off of media, because they're selling you the product. They're selling you things that they have really very little history on, meaning trial studies, the way they used to do it over time to know what they really do, how they really work, repetitively, huge cohort studies. And, it's like the pneumococcal vaccine that right now they're telling you, go out and get your pneumococcal vaccine, particularly if you're my age group, and so forth, you got to go get your shot. Well, this boy here hasn't had a vaccine in his body since he was in the United States Marine Corps back in the day when I was at Quantico. Why? It's my choice, because I know how to take care of myself. I know the things that upregulate my immunological response. During COVID, I wasn't afraid of you. I didn't wear a mask. I didn't care if you had a mask. I would do it as a courtesy to my patients if they wanted me to wear one, but I didn't otherwise. Because why? Because I know that the only time that you get sick is when your body's immune system is not working the way the good Creator, good Lord designed it to be. Now, if that's the case, what are you supposed to do about it? Well, we're going to talk a little bit about that today as it relates to your feet and what you should know about your feet. Now, don't forget, on the 22nd of January, the Results Center for Healing will have its first of the year in-house continuing education program. It's a free program to you. We don't charge anything for it. We do these programs because we want to give you the health truth, the information that you need to protect yourself. Now, we're going to talk about your feet and how it affects the rest of your structural system, how it affects your spine, all the way up from your tailbone to the top of your head. Why maybe those migraines that you're getting on an ongoing basis are coming from your feet not working properly. Why the pain that never goes away, whether it's internal, feels like, it's your intestinal tract. It could even be inside your chest. And so it may be coming from your feet. And we'll talk a little bit about that today and what that really means. So please join us on an ongoing basis. Make sure you understand that you have the best insight to your health beyond anybody else, not just your doctors, not just the media, not just the drug companies trying to sell you something, but understanding how your body works and the signs that it gives you. And if you take action beforehand and not put your head in the sand like an ostrich, but if you take action and you do something early on, the chances are not going to happen. I was on Facebook the other day, and there's a page that links back to my hometown. My high school graduating class was about 700 people. And all of a sudden, I'm at that age right now that everybody seems to be leaving the planet. It's like, what's going on? So I'm online and I know the answers, but I'm like everybody else. These are friends. These are people that were really close to me. And I'm trying to find out, why, what's happening to them? What's the deal? Why are we checking out? Why is it only that 20% of us is going to live, well into our 80s? I'm going to be one of them. I'm going to make sure that I'm here because I have a job to take care of you and make sure that you have all the information and I have the information and I can continue to contribute at a high level, and not just it's time to check it out. Let's get, I'm rolling. Let's get into what we need to talk about relative to your feet and the things that happen. So don't forget the 22nd of January, 6 p.m. at the Roselle Center for Healing in Fairfax. Register now. Go to rosellecare.com or drtomroselle.com. You can register either way. If you want to do it the old-fashioned way, 703-698-7117, and register so we can prepare for you, so we can make sure that we have all the space necessary, the seating, the chairs, and so forth and so on, that will make a difference. So here's the deal, okay? Here's what we need to know about your feet and what it's actually saying to you, the diagnostic. What happens, let's make believe your thumb is your big toe, right? And what happens if your nail or your big toe is spoon-shaped? It goes up. It's like a spatula. And what does that tell you? It could be just like your fingernails, by the way, could do both ways. It could be a sign that you have a chronic iron deficiency in your body. Now, you take a blood test and say, well, you're within the margins. It could be low margins too, by the way, or it could even be high margins. But what's happening is it's not transporting into your system. It's not getting in. There's a reason for that. But take a look at your toenails, and if it's spatulated up, right, there's an issue there. It could be an injury, to the nail. It could be, pressure on an ongoing basis. It actually could be exposure to oils, petroleum products, and solvents that would cause that as well. However, the iron deficiency is the most common, but it could be all of those other things as well. That's why when you, believe it or not, your socks that you put on, the best socks are cotton or wool socks, not all the synthetics, because over a period of time, they don't allow your feet to breathe, and they can cause you other issues as well. What happens if you have white toenails, right? Have you ever seen those? They don't look really well, and there's white streaking that goes down deeper into the bed. And what does that mean? Well, white toenails, if you will, could be a direct sign of liver disease, congestive heart failure, kidney disease. Covers a lot of things, right? But are you ignoring that? Say, oh, it's nothing. Or you go to your doc and you say, what's this all about? And they said, well, it's not a big deal. It's nothing. Your nails are normal. They seem to be okay, and so forth. No, it's an indication that though there's an illness somewhere in your body that's affecting that. So it can be that white appearance. It may be due to an injury, but that's usually localized. It's like one or two, but it's generally across the board. The nails themselves look pale. It could be a lot of things. It could be an infection. It could be the beginning stages of psoriasis and so forth. But that white presentation often is the beginning stages of either liver disease, congestive heart failure, or even kidney problems. Don't ignore it. Let somebody look at it so you can take the action steps before you have to have what? Before you have to have all kinds of drugs in your body, and your doctor talks you into this, and that's the only thing that we know what to do. Well, it's the only thing that they know what to do, but you haven't talked to me yet, or somebody like me in your area that has a little different insight to what's taking place. What happens if your nails are pitted? They really look awful. There's like striations, and they're white, and they're pitted areas all the way through. What does that mean? And, what do you have to do at that time? That's usually psoriasis. And you have a plaquing psoriasis. You can have, there's several different types, but that's a psoriatic presentation. And you don't have to go on the immunosuppressive drugs to get rid of psoriasis. But if you're willing to change lifestyle, the food that you eat, clear your liver out, the toenail fungus, which looks like yellow and deep and cracked and pitted and lifted and so forth, those are that's a problem. It also could be the signs of other things as well, particularly the lung patterns and the psoriatic patterns. It could be combined problems, and also could be suggestive of something called rheumatoid arthritis. Now, if you listen to me on the radio program, on WMAL 105.9, I talked a little bit about these dark spots on your feet. It could be, let's just, any toe, it doesn't make any difference what it is. It could be a little round, like somebody shot you there, and it's kind of irregular, but it's roundish and so forth. Or on your toe, it could be a direct black line that just straight up and down. If that's there, if it's kind of an unusual presentation, it just suddenly shows up, it can be the indicator that you might have melanoma. And obviously, it's a very dangerous form of skin cancer. So, melanoma can appear, if you will, underneath the nails. We talked about with that line, that straight striated line, or it could be that little black spot that wasn't there before on the side of the toe. If that's the case, do not hesitate. Go get it checked out like now. Uh, you don't want that to continue to move forward and really then perhaps if it begins to metastasize, which it can, go into different places. How about, what happens when you have claw toes? All of a sudden they start doing this, right? They weren't like that before. They start doing this. Um, Unfortunately, as a result of uh, blood sugars imbalances, alcoholism, obviously diabetes, is blood sugar imbalances, and so forth. Uh, they resemble a claw. They're kind of going down like this. They might respond to exercise and stretching and so forth, but when it happens, you got to clear up the metabolic problems. You got to get rid of the alcohol. Stop the drinking, my friends, because why put yourself in that place? Uh, a glass of red wine outside the country, so it doesn't have a lot of sulfite and glycophosphates. If you're not sensitive, you don't have fungus, if you don't have diabetes, if you don't have alcohol tendencies, have a glass, 6 ounces with dinner, 3, 4, 5 nights a week. Probably is not going to be a bad thing, providing the rest of you is okay. But nobody has to tell you whether if you say you go home and you're looking for a glass of wine or 2, 3 drinks to kind of calm yourself down, that's called a problem. And you need to make sure, but it's going to show up in your toes. And it's going to show up in your hands. And sometimes it'll be your toes first in a claw type of formation. We've talked about the itchiness of your feet, that athlete's foot infection. That's fungus. It may be psoriatic, but for the most part, it's you got don't let it go. Make sure that you're paying attention to what your feet are telling you. Often your feet will show up faster and first, more so than any other place. Here's the deal. The more information that you have about your body, the more that you have the ability, the opportunity to, if you will, be proactive. The more you can be proactive, the longer you're going to live healthfully, not just be present. I was at my alma mater about 6, 7 months ago, and I was teaching. There's about 50 young doctors, residents, interns, and I get pretty excited. It's for me, I donate to the school by giving them a day of information where I'm charging other doctors wherever I am throughout the world. But it's the way I give back. And I want these guys to understand what's first, what's next, what's last. And so the deal is that here are these guys, and they're getting excited. And he comes up to me, this one doctor, he's a resident, radiology, big white jacket, and radiology tag on him. Thought he's a big guy, right? And he said, "Doc, how long have you been in practice?" And I said, "Longer than you've been on the planet." He looks at me and says, "What?" I said, "What are you, 31, 32?" And he said, "Yeah, coming up 32. I said, "Way longer than you've been on the planet." And he looks at me kind of quizzically and he says, "What?" And he said, "What's the retirement plan?" I said, "Death." And see, he couldn't understand that life is about contribution. And what I'm talking about, why I'm bringing this up to you now is this. You need to contribute to yourself, to your family, to your community, to your environment. You need to be proactive. The more you do that, the more reason that you have to be present. But you also have more reason, if you will, to live well and healthfully. If you're shopping at the, if you will, the inside of the store and all the box stuff, you're killing yourself slowly. You know, the sugars, the sodas, the coffee, the black foods, all the nonsense. You know my mantra. If you're doing that, you're basically saying, oh, I'll just cut a little blood today and we'll drip a little bit more off and a little bit more and a little more. It's gone, right? There's nothing left. What you do is you shop the perimeter, but you look at the packages and you make sure it says non-GMO, non-genetically modified foods. You look and make sure they haven't added 10,000 things to your food. You make sure that it is as free-range, organic, and grass-fed if it's an animal product as you possibly can. You make sure that the vegetables that you eat, if you can't get fresh organic, get fresh frozen. That's the next one. Or ones that have been vacuum packed, but they're still raw. They've just been prepped for you. Canned is the last one that you do. But look, if you start doing those things and you look at the side panel, make sure that they don't put tons and tons of sugar in it, though that affords your sweet tooth, you're going to live healthier, longer. And all those things that show up in your feet are not going to be there. So let's kind of recap what we were talking about just a little bit. You know, if we have these toes that kind of lose their coloration, and they could be red, white, and blue. Interesting, right? That's a sign that toes that turn white, then bluish, then red again, and return their natural tone back and forth. That's a vasospasm. Okay, that means the blood vessel vaso tightens down, spasms, stopping the flow of blood into the tissue. Then it's beginning stages of other things. So if you have that Raynaud's, it could be a rheumatoid problem, it could be a Sjogren's problem, it could be a thyroid problem, but it's finger pointing and say, hey, we got a problem here. So by the way, if you want to find out truly if you have a vascular pattern in your hands or your feet, you can come to us or go to Thermography Centers of Fairfax and .com, by the way, and go in for a thermogram, because the thermography shows the heat distribution. And if there's a problem, it shows it like right now, faster than anything else. It's the quickest identifying piece that you got. Why not take advantage of it? Thermography Centers of Fairfax, do it. And when you have that information, now, are you willing to do what it takes to reverse and turn things around? If you are, then guess what? You got a shot. You got a shot at making things a whole lot better. You know, we talked about the heel pain, and it could be a plantar fasciitis, an inflammatory reaction, and so forth. Those can be fixed. That muscle can be relaxed. But ladies, you know, you keep contributing to chiropractors and physical therapists and osteopaths' retirement funds by wearing high heels, because you're putting yourself in all kinds of foot problems and all kinds of back problems and leg problems and so forth. You sit there and you rub your poor feet. Why? Because you want to wear those spikes and without a platform on them. So think about how we actually get into our problems. What happens if you're dragging your feet around? You know, sometimes the first sign of a problem in your feet is that the foot is dragging. It's, you know, the way that you're walking is not normal. You know, 30%, maybe even a little bit more of that, you know, of cases that are linked to diabetes have to do with that indicator, that sign, that demonstration. You're dragging your foot. On the 22nd of this month, Dr. Harlan Browning, the professor, and I are going to be talking about your feet as it relates to your skeletal health and the back pain that just doesn't go away no matter what you do. And is it really that you need orthotics, or is there something that you can do that's faster, that's better, that will make it better over a longer period of time in your lifetime, something that's proactive? Are you ignoring something that shouldn't be there? You are the driver of your own body. Let's get you the information. The 22nd of January, 6 p.m. at the Roselle Center for Healing in Fairfax. Join me. I promise you, you're going to go home with a lot of data. Mentioned it on WMAL. If you go to drtomroselle.com, go to Asia's Health Store, there are products there to keep you healthy. But one of the things I want you to do right now is I want you to take a good probiotic every day. I want you to keep your vitamin D level nice and high. I want you to make sure you take immunological supports. There's several there that you can utilize. There's Asacilium that you can order directly from the company that will help your flu symptoms. Do that. Check it out, drtomrosell.com. And anything that I can do to help you, remember, you can always reach out to me. You can always say, hey, listen, I need to have more information on this. I promise you I'll answer your emails. Always do. You can do one of two places, rosellcare.com, drtomrosell.com. Either way, we'll get it done. I promise you. Having said that, listen, you have an amazing day, and do these things for one reason only. You deserve it. And remember one thing. I love you all. See you next week. Bye.